Dr. Sanchez. Hi, doctor.
Hi, Irma. How's it going?
Good, good. And you?
Good,
How are you
good.
doing?
Doing very good, thank you.
Good to know, doctor. Today we're gonna be talking about diabetes and weight loss. What are the consequences of being overweight when you're suffering from diabetes? One of the main questions is why is weight loss so important?
Okay, I guess the first question should be is why is being overweight so important? Because, well, as you well know, or maybe not, diabetes is a metabolic problem. It's really a disease that occurs as a result of lifestyle, primarily, and also a genetic because of somebody else's lifestyle, our
Yes.
parents and grandparents and stuff. But it's a disease that occurs when we become overweight. So even if we're born from diabetic parents, if you're very thin and you're very careful, sometimes you don't develop the disease, even though you might have the genetic component. So because it's a disease that is also that part of it is genetic, but the majority is environmental because of the way we live.
Okay.
So being overweight, what happens is that your pancreas has to produce a lot more insulin because you're overweight. So your pancreas, which is the same size as all the rest of the pancreases, it has to produce a lot more insulin. So it works overtime, works more and more. And the theory is that eventually the pancreas burns out, the cells eventually get tired, they can't produce as much, and then you become diabetic.
All right, so that's technically a risk factor, right?
It is a very important
Yes.
risk factor.
Okay.
Because if you eliminate obesity, if you take it away, and if a person has the ideal body weight, nice and thin and good shape, many of those will not become diabetic.
I see.
Yeah.
And if I follow a diet, once you develop a diabetes, right? Because of the overweight. But if I develop a diet, can I cure?
Can you reverse the problem?
Can I reverse it?
You know what? That's a great question because initially you can. If you do it early enough, you can. Because the pancreas it becomes toxic because the sugar and the amount of fat that we have is bad for the pancreas.
Okay.
So the amount of fat, all the free fatty acids, they're toxic to the pancreas. So too much fat circulating in the blood doesn't help the pancreas. So when you start losing weight, you get rid of a lot of that stuff, that diminishes. Of course, if you're going to lose weight, that means because you're not eating as much sugar and junk either. So everything is better because all that drops and the pancreas starts functioning better. So if it's still early, you can reverse a lot of that and the pancreas will start functioning normally and it'll last a long time.
Okay, that's good to know because that's something I really didn't know actually.
Yeah.
Many people thought that you're diagnosed with diabetes and then you can get cured at all. One of frequent common question is if insulin is gonna make the patient gain weight.
Okay, wait. Insulin, there's a lot of types of insulin. That's a good question as well because the old type of insulin we used to use would make people gain weight, a lot of weight. They would gain a lot of weight because they were made from pork and from beef. The new insulins I think all of them now, or the majority of are now made from their human type insulin. They're not made, that doesn't mean we take that from humans, but we produce it in the laboratories. They program bacteria to produce human insulin, exactly like the human insulin that we have. So that one's a lot more favorable, but it's still a lot of insulin. If you inject a lot, it'll make you gain weight because humulin is called the fat hormone. It's the hormone that makes us gain weight and become fat.
Oh, I see.
So, yeah.
And how about the diet? I know that if you eat too much sugars, then it affects your health regarding diabetes. Are they strictly, or can you eat some like fruits or?
Well, yeah. If you're diabetic, one thing, there's different parts. You can be pre-diabetic, that they call that when you're barely starting, when your pancreas is already beginning to fail, but it's still producing enough insulin to get you going. So the sugar might be between 100 and 120. It's still a little bit high because normal is now under 100. So it's called pre-diabetes because you're a little overweight, you're starting that. And so the idea is if you eat any kind of sugar, it's going to damage more cells. It's just going to make your pancreas again overloaded with more work. So, but the different kinds of sugar, the reason I was telling that because if you're pre-diabetic, it's not as bad. Of course, you're getting some fruit and a lot more amount of carbohydrates, especially the healthy carbohydrates. But if you're fully diabetic and you're very advanced, then we can recommend very little sugar, very little carbs. And some of the fruit is very sweet. So it depends on the fruit that you're talking about as well. If you're going to eat grapes and mango and stuff, that's very sweet. So we don't recommend that anyway to diabetics.
Okay. And that was one of my next questions. Okay. Like if it's for fruits, which ones are they able to eat? Like
some better ones would be like apples, pears, and things that don't have too much sugar.
Okay.
And those are it.
All right. Yeah. What is the best way for a person suffering from diabetes to lose weight?
The best way for a person who is diabetic to lose weight is not to eat. It's to eat less. Count. Some people can do it by just eliminating certain foods, depending what your habits are. Some people have very difficult and bad habits, so it's hard to. It depends what you're gonna. But some people eat only meat, a lot of meat. Well, those are sometimes easier because you can a pure meat diet does not require insulin. So it doesn't add a lot to the pancreas. Okay, not as at least it's not as much. That if you're eating pure carbohydrates like pancakes and cereal and donuts and stuff, so we want to make them lose weight by eating less carbohydrates. Okay. Less carbohydrates.
Which will be the white foods.
All the stuff that has wheat. That has flour in it, and sugars and all the sugar they're called carbohydrates. But the fruit also has sugars. They're carbohydrates as well. So some fruit, like I said, are better than others because they have less amount of calories. So that's one of the things they can do. The other thing they can do is people that are diabetic, you can also just count calories and divide it, maybe 20% of carbohydrates, 20% of fat, and then the rest of it has to be protein and then fat. So there's diets out there that help you do that. And just if you're normally 3,000 calories, cut down to half of it, and you'll start losing some weight. Wow. The idea is to eat less calories. So you got to eat them. You got to get there somehow. Eating less sugar, less this, or less amount of food. But,
to manage your diet well, so you don't either develop it or get more sick.
Yeah, sick or get worse, out of control.
And well, you already said the diet, but is there any other special treatment that, for example, you can offer here at the clinic that can help you lose weight and it doesn't affect with your diabetes?
Well, weight loss, a good weight loss program. The best kind of programs for diabetics are medically supervised weight loss programs, because we tell you what to do. We analyze what you eat. We ask you pretty much what the habits are. We check also your blood tests, certain blood tests that we check the liver, make sure the liver is okay. Because if the liver is bad, then there's some things you can't eat either. You can't do it. So and the kidneys. The kidney function is very important. If the kidneys are beginning to fail, then we have to control the amount of protein they're eating too, and certain medications because they damage the kidney. So it's all combined. But when we check a patient out and we analyze all these things, then we come up with something that is more proper for that person, that patient.
Okay, all right. That's all for today. Thank you, doctor.
You're welcome.
And thank you for watching. If you have any questions, you can send your comments below or even call our doctors or visit them because they can give you the right and appropriate program for you to weight loss or even to take care of your diabetes. You can call us at 956-668-0044. And remember, we're located in 501 N Ware Rd, McAllen, Texas. And that's it for today. Thank you very much.
Thank you.
Bye.